And we're live. Hey, Anita.
Hi.
It's been a while. Happy New Year. Hi, everyone. I'm Hannah Ross. I'm a pelvic physiotherapist and owner of Vital Physiotherapy and Wellness in Toronto. And I'm joined by my good friend and colleague, Anita Lambert, your holistic health physio. And we're actually really excited today to be talking about the fourth trimester. And I think a lot of us moms are familiar with talking about that in relation to our babies, but did you know we're also talking about our bodies in the fourth trimester? So we're talking about today what to expect, what to do, how to optimize this time frame. And we're so excited that you're joining us. Please, as usual, any questions, any concerns, jump in. We love to hear from you. Please post your questions in the comments. And if we don't get a chance during the live broadcast, we will definitely answer them afterwards.
Yeah, and exactly. I think the first 12 weeks, or we call it the fourth trimester, is a really critical and important time that there's really not a lot of information out there. And Hannah and I, we did a Facebook Live. Our last one was on the first 2 weeks postpartum. So we talked about tips of healing your perineum, talking about after cesarean birth, and also our top resources. So for specifically those first 2 weeks, I highly recommend going back and checking that out in both of on our Facebook pages. You'll be able to find under the videos that one as well. So if you missed it, definitely go back, catch that. But also hang in here and catch about more the 12 weeks, so beyond those first 2 weeks.
And we'll link that Facebook Live in the comments also later on once we're done. Okay.
Yeah, exactly. Yeah, so if you're watching and you're pregnant or you're postpartum or you know anyone who is, please share. Just click share. And because this is really information, like I was saying, that really no one gets to hear about. And Hannah and I, who are both pelvic health physiotherapists, we have clients coming in, months or years after giving birth who say, like, why did I not know this sooner? So
Only
this is
I would have known.
Exactly.
Yeah.
So this is your chance, if this applies to you right now, or if you know others, that this can actually be really helpful for. So so please share and leave your comments and questions, as Hannah mentioned.
Awesome. And I think we should just jump in. You ready?
Yeah.
Okay. So let's talk first about why are we creating this differential between the first 3 months, the first 12 weeks postpartum versus the rest of the postpartum period? So what's different about it?
Yeah, I think it's really important because literally our body changes overnight. Baby comes out and we're adjusting physically, mentally, emotionally to either being a first-time parent, or if you have had given birth to other kids, you're adding another one to the family. So, I mean, there's a lot of changes, and I know we only have a certain amount of time. We can't go into detail about everything. We're going to focus on the pelvic floor and core, but I just think it's important those first 3 months, there is a lot of changes for you physically, mentally, and emotionally that are important. And one of those kind of briefly—
all of them need to be addressed.
Yes, exactly. And there are various professionals that can really hone in on different parts. One of them being hormones, which gets talked about a little bit, and naturopaths, as well as your care provider, are great people to seek out information about. But something you'll hear a lot about is estrogen levels. So estrogen, in regards to our pelvic floor and muscles, is it gives our muscles tone. So it can affect our pelvic floor and how it heals as well. And often estrogen is talked about that it will be quite a bit lower if you're nursing until you're done nursing, until those 3 months after you're done nursing. So just something to keep in mind. Hormones are a big part of how we heal as well.
Yeah.
But specifically pelvic floor and core. So our perineum, we're often told, it's 6 weeks and then everything is magically healed at that point. But what we want you to know about is that's just the first stage of the physical healing, right? So if you've had sutures or stitches, whether you had tearing or an episiotomy, during those 6 weeks, that component should be healed. So whether it's your stitches are dissolving or they've come out on their own, some care providers need to take a few out at that 6 week mark if they're kind of, not healed properly. Or if you didn't have any tearing, a lot of the swelling has come down at that point. So that's kind of the initial healing in terms of the perineum. There's still the other part where we need to retrain the pelvic floor and the rest of the core canister. So for those who are new to the pelvic floor, Anna and I usually have our pelvis. So our pelvic floor, the muscles, they attach from your pubic bone to your sit bone to your tailbone. So that whole area is your pelvic floor, and there's three layers.
I'm still busy with my organs. I'm sorry. I'm catching up. Okay.
And so there's a lot of healing. And so they have important jobs, right? They stop us from leaking urine, stool, and gas. They support our organs, our bladder, our uterus, our rectum. They help with breathing. They help to support your tailbone, sacrum, pelvis, low back. They have so many important jobs, and 6 weeks is just not enough for them to go, to fully heal properly and for you to return to, every activity that you want to do. So
it is enough for the wounds to close, but not necessarily, but you should expect more than just your wounds closing. Yes. That's, I think, a fair assumption.
Yes, because you need to retrain, whether it's strength. Some postpartum moms will have tension or tightness. So if you've been to a massage therapist, right, they get into tense muscles. Your pelvic floor is another set of muscles, and those muscles can be tense as well. So it's important to know there's different factors involved. And we're going to talk more about that 6-week green light appointment in a little bit. But just to be aware, like 6 weeks is just the starting part. That's why 12 weeks is really important, because you need to give your body at least those 3 months and beyond. There's more to it than just those 3 months of healing.
Right.
The other part I want to talk about a little bit is cesarean birth, right? So a lot of times after cesarean birth, 6 weeks, we talk about the scar getting that initial healing. But as Hannah and I work with clients, there's so much more. Eventually we massage the scar, and then we work on that whole inner core canister as well. So how do you feel about that, Hannah? Do you agree? Like 6 weeks is just the start, and then
some, you know what, like full disclosure, like some people need 8 weeks for those actual scars to heal. Some people actually need the 12 weeks. Like when I think of like just basic tissue, normal tissue healing time, sometimes it really is even that 12 weeks. So I would say like it is the bare minimum. Like that 6 week mark is like, you're just eking past that, that kind of landmark point.
The tissue. Yeah. Just the tissue specifically, right?
Yeah. Yeah.
And then how do you feel about like diastasis? I know we did do a Facebook Live fully on diastasis. So we're going to link that. We're going to link it in the resource. But
I think like this is, okay, so diastasis is a really good reason why we talk about this 6 week green light kind of being bogus, right? Like when we think about like just a basic, like if you broke your ankle, for example, it would take 6 to 8 weeks for that bone to heal. But we understand that after that, you go to physical therapy, you're going to be on crutches, you're going to walk, like we understand that would take longer. And so we get that healing times take longer. And yet when it comes to postpartum, we're like, nah, it's fine. Right. I think that we as women, and our clients in general, like deserve to say, yes, you need the time to heal, and the fastest way to heal is to do it slowly. So at 6 weeks, like you just mentioned, there's really only that tissue has healed. The two sides of a scar essentially have come together. You're not as swollen from pregnancy. From delivery. Sorry. There's a lot of stuff that is getting better. But having said that, it's at this point where you have to start to retrain your inner core. And the thing is to say, okay, go and work out. Well, we actually don't know what is safe for you unless you've been assessed by a pelvic floor physio or by a trainer who knows what's how to work the inner core. You need to take a step back and say, okay, now is time for me to actually start to rehabilitate and heal from the inside out. And so saying at 6 weeks, like, yeah, go running. Well, we don't know what you have to rehabilitate. So you need to go be assessed first. And one of the things that we talk about is pelvic floor, right? If there is a scar, we have to treat the scar. If there's a cesarean scar, we have to treat the scar. If there's any leakage, if there's pain with intercourse, if there's a whole host of stuff that has to get dealt with that tells us what the integrity of that inner core system, that pelvic floor, that diaphragm, that inner abs and inner back muscles, they have to, we love Julie Wiebe. She talks a lot about how this is a system that is anticipatory, meaning it used to turn on before the rest of your muscles turned on. And it's hugely affected by pregnancy, and needs to be retrained postpartum in order to function optimally. And so to go back to that ankle example, like you wouldn't go running, 6 weeks after spraining an ankle, you wouldn't just go running again. You would first rehabilitate and then run. And I think that our core needs to be treated with the same amount of respect. Let's retrain it, and then we can get you back to your exercise. And things, within that core system, we talk a lot about diastasis recti, and diastasis is when the tissue between your 6-pack muscles, so imagining that this is a 3-pack and this is a 3-pack, there's, they kind of sit side by side. During pregnancy, there's this stretching that happens. I feel like I'm playing peekaboo right now. There's a stretching that happens in order to accommodate a baby, because that's what those muscles are supposed to do. And it is totally amazing that it does that. In the first 6 to 8 weeks postpartum is a time when those tissues would naturally kind of come back together and recoil. And if those tissues have not done that at that point, we actually need to retrain them. And so returning to the gym at that point is just, taking a weakened system and then adding more pressure onto it. So we kind of get like very caught up on this 6-week number, because really, again, it's the very bare minimum, but we deserve so much more than the bare minimum. We can set you up for success, so that you are working out and, playing with your kids and jumping on the trampoline for years after this, not just for the first 3 months and then being like, okay, I think I'm gonna see a pelvic floor.
And then going backwards, right?
Yeah. I mean, and the thing is, many, for my first postpartum visit, I have 3 kids. My first one, I got a pap. It was like a whole, to do, second and third, like you don't even get an internal exam. So when they say to you, if you've had a vaginal delivery and they say to you, yeah, you have the green light, how do you know that? Nobody's assessed you. You need to be assessed.
And I think that's a good point to bring up too. We wanted to talk about the 6-week appointment, and how you said with your first, like you had a pap. And I think it's important for anyone watching to understand that at the 6-week mark, I find that's the most common time. It's pretty rare I'll have clients say they had an internal to check the muscles. It's usually because you're due for a pap.
Right.
And if your care provider is going in to do a pap, they tend not to be looking at your muscles. Some do. And if they do, they would be letting you know. So if they don't mention anything about your muscles,
providers are sending, they're like, you need to go for pelvic physio. Like they are really caring for their clients. Yeah.
But then it doesn't happen for everyone. So just be aware, if you have a PAP, it doesn't mean that they've actually checked your muscles. So it's really important, like that 6-week, and you'll find at that point too, then, well, even right after birth, a lot of the care goes towards baby, right? It's not as much about mom anymore. And really your care provider is there to rule out a lot of the red flags. So to make sure there's no infection,
did they miss any stitches like you mentioned?
Yeah, exactly. Any stitches that need to come out, or if you've had a cesarean birth, if there's infection, like anything to do with the scar, make sure your uterus has contracted properly. All of those things, that's really what they're looking for. So doing kind of the muscle rehab and retraining is often, in terms of the physio side of it, they won't necessarily be looking at that, because it's not necessarily a priority when they're looking at you.
It's not their scope, right? It doesn't mean you have a poor care provider. It just means that's not what they do, right? So we can't assume that they're going to do that, because it's not within their scope of practice.
Yeah. So no, I think it's just good to bring up that kind of 6-week, just to be aware that it's much more. I feel like, I don't know, I've never actually had a client never get the 6-week green light. So that's why I'm like, the 6-week green light, it's kind of one of those things that just everyone gets anyways. So just know there's much more to it, and it's important to check internally. And I know Hannah and I have talked about this, like we have a lot of clients who don't necessarily have symptoms at that point, but it's good
what
to
symptoms would you be like, okay, this you should definitely get checked, and with the understanding that not everybody has symptoms, you still need to be assessed.
Yeah, totally. I mean, there's so many things like leakage, so urine, stool, gas, pain. So any sort of pain, like pubic bone pain, SI, like sacroiliac joint pain, tailbone pain, back pain, hip pain.
Back pain.
Yeah. Any of those types of pain. And then also the other thing too is internal pain, but you may not know you have this until you actually have intercourse or any sort of internal penetration, or you start using a tampon or Diva cup. You may not know that this exists. And often that internal pain has to do with tension or tightness in those muscles. Yeah. Really important to have addressed. And I feel like I have so many clients who had this internal pain for a long time and never really got answers until they came in for pelvic physio, and then find out these muscles are tight. They learn how to release them, and that solved their issue.
And you changed their life.
Well, that's the thing, right? I think so many clients are just like, why does no one talk about this? Yeah. Especially the tension or tightness in the muscle really rarely gets talked about. Yeah. Other symptoms are heaviness. Yeah.
I just wanted to add in also that a lot of people will come in and be like, I came for my assessment because my friend told me that at 6 weeks, I need to come in for a pelvic floor physio assessment, and I don't have any symptoms. And then once we actually get to talking and they understand the anatomy and they understand what could be indicative of pelvic floor issues, all of a sudden they're like, oh, light bulb moment. I guess I do have some stuff going on. So sometimes there's an educational element too. So even just going, it's so awesome to go see a pelvic physio to learn about your body and understand how it functions. And if you're awesome, great. They'll be like, it was really nice to meet you. Go do what you need to do. Right? Yeah. No harm, no foul.
Yeah. Yeah. No, it's true that there's things you may not be aware of. Or the other thing too is you may be having symptoms and a lot of women get told they're just going to go away. Yeah. Right? And it's better to get them dressed sooner than later. And oftentimes they don't tend to go away on their own. And if anything, sometimes they do get worse. So it's just something to not ignore symptoms. Or our comment we often say is a lot of these symptoms are common, but you shouldn't consider them your normal, your new normal. They're a sign that your muscles just aren't working the best way they could, which is common after childbirth or during pregnancy, but can definitely be changed. Yeah.
I mean, again, we deserve to have an optimally functioning body. Just being okay is not okay. We can be amazing, and that should be our goal, right? So anybody who's joining us now, please say hello. Thank you for sharing our time here. We are talking about the first 12 weeks postpartum, the 4th trimester. Thank you for joining us. Please share with your pregnant and postpartum friends. We really believe this information is really valuable, and we're happy to answer any of your questions. So, okay, this is the biggie here, Anita. What exercises can you do then during this time?
Yes. Yeah, I know that's is a big question.
I get it, but I want to exercise. So what?
I know. So big question. So, we initially talked about that rest period during that first, especially those first, 4 to 6 weeks postpartum. But things you can do even during those times, things I'll tell my clients, if I see them during pregnancy, we put together this plan of what they can do postpartum, regardless of how their birth goes, that they can start, implementing and rehab and retraining from the get-go. So one of the key things is posture, or this idea of stacking your ribs over the pelvis. So this is thanks to Julie Wiebe, who is a physiotherapist in the US.
Yeah, I think we're good.
Yeah, it talks about ribs over pelvis. Hannah, are you able to demo this on your end? Are you able to stand? Just so that you can understand.
I'm in a new space today, so I'm not sure. Let's see if it's going to work.
So the idea is because your pelvic floor attaches on the bottom of your pelvis, right? So we want to stack your pelvic floor and your diaphragm, which is the top part of your core canister, which lives under your ribs. So as Hannah's demoing, kind of if you can see where her ribs are, and then over her pelvis, is what we want to do. Yeah. And when they're stacked, and you take a deep breath, your breath will naturally go into your ribs.
I'm wearing the worst clothes ever for this. Sorry, Anita.
That's okay. You're demoing well. Yeah. To open. So you'll feel your ribs open like an umbrella. And that's really to let us know that your diaphragm is, doing a great job. And so ribs over pelvis, I'll have clients think about that when they're holding their baby, going for a walk.
So
just
not
take a random breath.
like this.
Yeah, because if you stand that way, so stand how you were, Hannah. So if you stand with your kind of, this is a common pregnancy or mom posture.
Like tuck under.
Yeah. Hannah's ribs are behind her pelvis. And when she stands like that, oftentimes if she were to take a deep breath, it often will go into her chest and not into her ribs. So I'll have clients do this in my office, and usually that's what happens. And then they go to the new ribs over pelvis, and all of a sudden it just opens their ribs.
Right.
So that's a really great place to start, just thinking of that postpartum, especially during those first 12 weeks throughout your day, but also with exercise. And then we've talked about before in other Facebook Lives is the core breath or piston breath. So this idea where you take a breath in, your pelvic floor lowers, and as you breathe out, your pelvic floor lifts. And you can think about picking up a blueberry or a bean or picking up something at the front, the vaginal opening and rectal opening. So as you breathe out, and oftentimes I'll have clients start that one, when they feel comfortable doing it after birth. And I usually pair it with something. So I'll say, every time you change the baby's diaper, which during those first, few months, it's often 10 to 12 times a day, right? So doing it once you change the diaper, getting your ribs over your pelvis, doing a few just to get things starting to move, increase circulation in that as well.
And as long as there's no pain when they're doing it.
Yes, exactly. Right. There really shouldn't be any pain. It is, and that's the thing, it's super gentle, right? Yeah. But then the other side is I also have clients do the flower bloom breath. And that's where you're releasing and relaxing the pelvic floor. So that idea is you inhale, you're picturing a flower bloom out of the vaginal opening, exhale, keep it open. So this can be helpful if you have tension or tightness, whether after a vaginal birth, after a cesarean birth, which can be really common. I'll have clients pair that with another habit. So every time they feed, whether bottle feeding, nursing, doesn't matter, doing a few of those. So that way they're just fitting it in, each one of them a few times a day. It's not, there's no pressure with it. You don't have to feel guilty about not doing it because it's paired with a habit. And I know that's what I used postpartum, especially initially those first few weeks. You're doing certain habits or certain activities a lot. So why not just add a little bit of this rehab into it, which sets you up for a good start?
Yeah. Yeah. Mm-hmm. I mean, the other thing is also that, like, we talked about also in our last Facebook Live walking, right? So that when people say, oh, you can go for a walk, they're like, all right, so I walked 7 miles today. And I'm like, first day you can walk around your block, and then the second day you can walk around 2 blocks. Everything should be really gentle during this time. And I get it. It's so, in the 9th month of pregnancy, you're just like, I just can't wait to be back to myself, after delivery. And then you deliver a baby and you're like, I still feel like I'm 6 months pregnant. Like, what is going on? And so there really is this like urgency to like get back to things, right? But again, the fastest way to get back is just to slow down. Your body needs the time to heal. And so while movement is awesome and walking is really great, it helps constipation, it helps, with blood flow, it helps keep things going. It's really, really a wonderful form of exercise, even during these first couple of weeks. I think you really need to think about how you're going to gradually increase that, and not be going for a 5 mile,
jump into things, right?
Yeah.
Because I think that's really important. It's like starting that way. And I know today we're talking about those first 3 months. So building up over, past those initial 6 weeks. So even after, gradual walking, you get your 6-week green light, if you can, and see a pelvic physio at 7 weeks, 6-7 weeks, because they're able to then guide you back to your goals. And if you can't, there's also online programs that we wanted to mention. Or if you're seeing a physio, combining these is great as well.
Yeah.
And a lot of these you can start early. So these are, rehab and retraining exercise programs to do at home that you can even start within the week after birth. They do not include planks and sit-ups. You are not jumping. This is not in camp. This is that initial like rehab retraining, really needed part of your postpartum recovery. So some of them can take 8 weeks or beyond that, and we'll put them in the resources. So some we wanted to mention, so Julie Wiebe has a great online course. Jessie Mendel has one for either vaginal birth or cesarean recovery. Brianna Battles has a great one too, and her focus is with CrossFit. So a lot of my CrossFit moms enjoy doing this one as well with their physio. And then also Belly Zinc has one too. So there's definitely a number of good ones out there online.
And Muchu System is fabulous as well. There's some really great online resources, so you can feel like you're moving through a program, but also, you know, in a way that you never have to second guess it.
Yeah. So that's why this is, you know, we're talking about, again, first 12 weeks, first 3 months, the rehab and retraining. And then also, like, if you're someone who enjoys lifting weights, and I have a lot of clients who do to varying degrees. Some are like heavy into CrossFit. Others, you know, enjoy going to the gym and just lifting weights or lifting weights at home. So something to keep in mind, if you want to return to weights, again, do this rehab, restore, retrain. But then when you start getting back to weights, also think of, even if you lifted weights to the day you gave birth, we highly recommend you do not start back lifting the same weight you did the day you gave birth, right? Your body went through a lot, whether vaginal or cesarean birth. You need to give it time to restore. So starting with a lower weight.
It's almost shocking also how much, like, in your mind, what you think you're going to be able to lift, and all of a sudden you're like, oh my God. Like, you usually really, you can't, not only should not be, but it's difficult to be lifting that level of weight.
Yeah. And another thing too, we want to bring up, and both Hannah, I mean, I've got one little one, Hannah's got 3, lifting car seats, lifting strollers, lifting babies. If you already have a toddler and another kid at home, you're doing a lot more activity than you think during these 12 weeks. So just to be, I remind clients of that too, who it's their 2nd, 3rd, 4th, or beyond baby. And I'm like, you're doing a lot of lifting
and you're doing
really early.
Yeah.
Because you need to, because that, like, you're at home. So just to be, you know, give your body that time, that rather than jumping into heavy weights on top of all the lifting you're doing already, just because
recognize your body's doing it anyhow. And you know, and this would be a good opportunity to even chat about support, like abdominal supports, and different, and you know, the support shorts. We did talk about them back in our last Facebook Live, but I do want to bring it up as if this is not, you know, if this is your first baby, we kind of, it's a way to help assist with your recovery. It is not the be all and end all, but like full disclosure, for somebody's 2nd or 3rd, I really do recommend that you have some form of support, because they are going to be lifting a heavy toddler immediately postpartum. It's nice to have a little bit of additional support while we are trying to rehabilitate your body.
Yeah, and I think it's important. So there are different ones out there. There's, Hannah mentioned, there's core recovery shorts. There's also some abdominal wraps. None of these should feel like a corset. This is not an ab retrainer by any means.
Emphasis on the word gentle. Yeah.
It should feel like someone came around you and is gently hugging you all day. Like, it should feel like a good support, because
so nice.
it should feel like, it should just feel like someone's hugging you. In a good way, because anyone who's had kids, if you're watching this, postpartum, like right after, like, regardless of what core work you did during pregnancy, like, your stomach, it's this mush feeling. I can't even describe it. And when people tried to describe it to me, I didn't know until, again, I gave birth. But so that corset muscle,
it's a miracle.
Yeah, that's like part of your core, right? So in terms of your pelvic floor, your diaphragm, we've got little muscles along the spine, but then we have this corset muscle that wraps around. Having an abdominal wrap or core recovery shorts just really helps to kind of add to that while that muscle is also healing. The same with your pelvic floor. So it should never be difficult to breathe, talk, move. If anything, it should feel better if it's something that is going to help. And usually it's around the first 6 to 8 weeks that often people will wear something.
And I mean, we touched upon this ribs over pelvis posture, you know, about 3 minutes ago, but I want to kind of bring some practical discussion to that, because we talked about carrying your baby, but I want to talk about baby wearing also. And so what we find out, like, baby wearing is like the greatest thing ever if you want to brush your teeth. It is like incredible if you're thinking you want to put some, milk into your coffee. Like holding a baby and multitasking isn't really, not really so easy. So so baby wearing is an incredible thing to have in your back, to have at your disposal. Having said that, posture during baby wearing, postpartum, we get it. We do these things repetitively: breastfeeding, baby wearing, lifting baby in and out of a car seat, holding a car seat, and they end up being these things that we do over and over and over again. And I remember after my first, like at a certain point, I was like, oh my God, like my pinkies are tingling because I was spending so much time like breastfeeding my baby like this and looking at her. And I was like, why are my fingers tingling? If we think about, it does seem a little bit annoying to always be thinking about ribs over pelvis, but it's no different than having a desk job. It is different because you have a beautiful, miraculous baby, but they are postures that you're in on a consistent basis. And so if you're in these postures and you're not stacking ribs over pelvis, not only are you putting yourself at a disadvantage, it's an actual opportunity where you can push yourself further in the recovery process just by thinking about it. And like you said, Anita, like creating a habit.
Yeah. It's just habits and using whatever you need, like using pillows or, if you are nursing and you get to a point, I know with Pippa, I started doing more sideline nursing if I was home, like around 7 weeks, because her head control, it was just a little bit easier to do. And it was kind of nice. It was pressure off like my body. We could lie down, we could both relax. I know that isn't an option for everyone, but it's just that idea of like different things you do throughout the day. There may be different ways of doing things so that your body isn't doing the same thing all the time or in the same position, so that your body gets variety, because that's the other thing our body loves is variety and movement postpartum.
But I'm forgetting who said it. If there's no optimal posture, your optimal posture is actually your next posture, right? I think I'm harping on Julie Wiebe today, but Julie Wiebe has a really great suggestion where she suggests rolling up either a yoga mat or a towel or something, and you put it at the edge of your chair, like at the back. And if you sit on it, what it does is you can sit on your sits bones, and it actually just tilts your pelvis slightly and actually puts it into alignment so that it's right underneath your pelvis. So all you have to do when you sit down, if you're going to be nursing and sitting, or you're going to be feeding and sitting, is just sit back, sit on that roll, and you come back, and all of a sudden you're like, all right, it's a total life hack, and you don't have to think about ribs over pelvis. You just happen to be in that position.
Yeah, I love that one. I give that to a client a lot for in the car, because car seats for adults aren't ideal either per se. But that's a great tip for nursing or just sitting in general. And so that idea, you're putting the towel right at the back, so it's not going in your curve in your low back. Literally, it's at the back of your chair. You're going to sit, and you're going to feel like you're going to tip off the towel. It's going to tip you into
hook your sits bones on it.
Yeah. So that's a fantastic tip, Hannah. That's great.
And I just wanted to talk about baby wearing once more, because what I find a lot, and I'm going to stand up again, is that clients wear their babies like low down here. And what that ends up doing is they end up in that position. You really want to bring your baby up so that you're holding the baby right here. So you want to make sure that your baby wearing device, whether it's a wrap or it's a Bjorn or it's an Ergo, whatever you're choosing, is nice and snug, so that it feels like a part of you and it's not a thing that's hanging from you.
Yeah, I totally agree. And a way you can test to help, going back to initially what we talked about, ribs over pelvis, just take a deep breath. Like once you have baby on you, take a deep breath. If your breath is in your ribs, likely you're stacked. If it's chest or all abdomen, you're likely not. So just bring your ribs forward over your pelvis. Baby should still be able to be secure. Find that position you can get your breath into your ribs, and then keep going.
Awesome.
Mm-hmm.
Okay, I love it.
Mm-hmm.
So if for anybody who's just joining us, Anita and I were just chatting about our recommendations during the first 12 weeks postpartum, the fourth trimester. And one of the biggest ones is go see a pelvic health physio. What we're going to do is we're going to link also to, if you are in Toronto, sorry, I think I just froze for a second. If you're in Toronto, we're going to link you to, or in Ontario in Canada, we'll link you to Pelvic Health Solutions, and they have a find a physio drop-down menu on their website. If you are out of Canada or out of Ontario and you're looking for a pelvic health physio, please drop Anita and I a line and we will help you find that. We're going to link to our last Facebook Live past the first 2 weeks postpartum, because there are some special considerations during that time.
As well as healing items.
Yes.
Yeah. There were healing items we talked about. So if you're pregnant and watching this or know someone who is, there's really good resources in there about, items to have to help with your healing postpartum, to have even before you give birth.
Awesome. And we're going to also link to Anita's awesome cesarean massage video. So it's really important to touch whatever scar that you have. There's Anita has a great video on philosophically how to touch your cesarean scar, but it's a great how-to. So Anita, where can people find you?
Yeah, so you can find me online. So you can find me on my website, holistichealthphysio.com. You can also find me on Facebook and Instagram at Holistic Health Physio. And how about you, Hannah?
Awesome. So you can find us on Facebook and Instagram, Vital Physiotherapy and Wellness. I believe on Facebook it's Vital Physiotherapy and Wellness, Vital Physiotherapy Toronto. You can find us on our website, vitalphysiotherapy.com. And if you'd like to connect with me personally, it's Hannah Ross, registered physiotherapist on Facebook. And we love to answer questions. So please do not be shy. Connect with us. Let us know what you thought. Let us know what you're thinking for videos that you would love to see. We would be happy to do that. So Anita, our next video, this is going to be a good one, is going to be on our top tips for helping you heal from pelvic girdle pain. So pelvic girdle pain is really interesting. A lot of people come in thinking that it's low back pain, or they have hip pain, or, they have a whole host of other stuff. They've been told their pubic symphysis is separated. There is so much that you can do. And we cannot wait to chat with you about it. Please be sure to like the Holistic Health Physio Facebook page and the Vital Physiotherapy Facebook page. We love to bring you this information, and we love to hear from you. And we really can't wait till our next video.
Great. It was great chatting with you, Hannah, and thanks so much for joining us. Make sure to leave your questions below. We're happy to answer them even after we go live.
Okay. And if you missed it, please watch the replay. Have a great night, everybody.
Yeah.